Yeah.
Oh, got it. All right.
Yeah.
Right, hi guys, thank you for coming. I'm really pleased to introduce Kate Roxburgh tonight. She's going to talk about vet physio. I watched one of Kate's talks before and it was really, really interesting. So for anyone that shares their life with a dog, you're going to take so much away from this. So I'm not going to hang about. I'm just going to pass you straight over to Kate.
Right, I'm still going to just sort out this screen share because I can't see it properly.
Right,
myself.
okay.
Can you see my screen all right?
I can see. Yeah.
Is that better?
That's it, like
Yeah,
that.
that's better.
Yeah.
And then you should have, I'm looking somewhere, you should have start sharing or so. Oh, actually, like that is it, isn't it? Yeah. So then you can just do your buttons.
That's all right.
So you can see it all. I'm going to be I'll keep the side part on because I'm going to be moving around because I'm a little bit hectic when I do I go all over the place when I think of things. So anyway, thanks for coming to this talk. I'm Kate Roxburgh and I'm a qualified veterinary physiotherapist. I've known Debbie for a little while now and I've got a rescue shepherd of my own, so my passion lies with shepherds and I've worked with them in rescues for many, many years now. So I'm not going to specifically talk about shepherds today, but we can definitely at the end talk about some things like hip dysplasia and some other spinal issues that a lot of them get if people have any questions. So hang on to all your questions and we'll definitely get there. I'll whiz through this and then we can sort of open it up. But if you think of something along the way, I'm fine with you to interrupt me. I have no problem with that because sometimes you forget what it was you wanted to know, you know. So this is nice and relaxed and this is for you guys just to sit back and enjoy, and then if something pops up just give me a shout. So we're going to have a little bit of a look at why we do physiotherapy for dogs and why it's so important, and have a look at the anatomy and physiology, because without understanding a little bit more detail behind that, it's hard to explain what the problems are and then why we're doing what we're doing with the treatments. I'll spend a bit of time on gait analysis because it's my passion and I love it. And I feel like it's one of the things that vets don't often have a lot of time or sometimes space to really do. So it's an important thing for a physiotherapist to do a proper gait analysis, and then they can see a lot from that and also refer back to the vet and let them know what you've seen. And it can be really helpful for a vet where something's slightly undiagnosed. We're not actually allowed to diagnose ourselves, but over time, if you develop good relationships with certain vets, they're really fine. They put their ego aside. And if you're just trying to problem solve together, it's really nice because you can just make suggestions and say, have you thought of this? And I've seen this before and it reminds me of it. What do you think? And quite a lot of the time, they're really receptive to that. So it can be a really nice team. And I enjoy that side of things. And then we're just going to have a look at the end of some of the common conditions, how we treat them, and also how we can maybe identify them through the gait analysis or through some of the just manipulations that we do. So physiotherapy, it's just really about trying to reduce pain and have the dog walk and function as normal before the way they were before the injury or the illness. So we're trying to get them back to as near possible as normal as possible, whilst also managing pain and inflammation. Chronic inflammation is a problem that we come across a lot that can then lead to sort of things like osteoarthritis and stuff like that. And we'll go over that a little bit.
It would mean the court doesn't need to do that. We can't be 100% sure of that until a case goes through the judicial system. But if the European Court was to put down an injunction, there is a provision in that legislation that would allow for ministers to ignore that altogether. It's not without precedent. There has been a scenario in which that has happened before, but it would be a highly...
There we go. Might be more interesting. So why do we use physiotherapy? We try and speed up the healing time, which can happen both with neurological problems and tissue healing, nerve regeneration, all sorts of things like that. We can reduce unwanted inflammation and we can also reduce pain. Those are the main things that we're doing. And then we can also do things like targeting certain areas and strengthening muscles that may have atrophy due to lack of use because of injury. So we're trying to actually create core strengthening, specific target areas of strengthening, and also body conditioning. And then we can also look at range of motion, so we can improve the range of motion. Can you see the cursor when I point it around on the screen? Yeah. Okay, yeah. Brilliant. That's going to really help later on. Yeah, okay. And great. And then we're just really looking at the animal's overall well-being and feeling of happiness. So first of all, we're just going to have a quick look at, I just put up a basic one that I found, beautiful little collie here, that we can just put. I like this diagram because we can really see where everything is, because when you're doing physiotherapy, you're really working like Braille. So when you're feeling the animal, you've got to find your bony landmarks to understand where you are on the body. And a lot of these places are very specific to where injuries happen. So, for example, we can feel the shoulder joint here. We can find this is the radius and the ulna. This is called the olecranon. A lot of attachments happen here, muscular-wise, from here to here. We've got the scapula here, which is the shoulder blade, and this spine around it along here. A lot of things attached to that, which are really important. So it's good to be able to feel the spine and the scapula, the shoulder joint here, which is the head of the humerus, this olecranon here, we've got the little carpal muscles here, and then we've got the top of the hip. So this is basically, behind this is where your sacrum is. And you know, a lot of people talk about sacroiliac joint or the lumbosacral disease. That can happen a lot in shepherds as well. Well, we know where to start locating that just by feeling the gap in between behind the hip joint, the pelvis bone here. Then we've got so this is actually called the wing of the ilium. Then we've got the ischium, which is the point of the bottom here. And again, a lot of attachments that are really important start here. The muscle starts on this point and then attaches to the base of this is the femur. So it can attach to the base of the femur, and it can go all the way down to your Achilles here. There's a lot going on with just this small area of the dog that when you palpate, you can feel if the sciatic nerve is inflamed. You can feel if the hamstrings are atrophied. So there's all sorts of things that can happen on this point, which is really important. And then we can look at the stifles, the knee. We've got a lot of issues. So the patella sits at the top here. Here's your femur bone going down. So the patella sits in a little groove at the base of the femur. But there's also your quadriceps sitting on top here, and then a lot of ligaments that hold that in. And between, this is your tibia, and this is your fibula. Between the tibia and the base of the femur, over this, we've got our patellar ligament. You can actually feel that. You can palpate that. You can feel if it's nice and elastic or if it's gone. Like one dog that I couldn't feel the patellar ligament, and he'd had a high impact moment in a tree and created this trauma. The vet and the knee was swelling, and the vet had said, "Oh, it's just hurt its knee, it's fine." But actually what had happened, it snapped its patellar ligament, and I could feel that just because I could take the time and really palpate and go, that's gone. So these are little places that you can just find injuries. A lot of times these are all synovial joints, the shoulder joint, the elbow joint, the knee joint, and the hip joint here, ball and socket. These are all synovial joints, which means there's a fluid called synovial fluid that feeds the top of the cartilage, that keeps that cartilage nice and healthy. The cartilage sits over the top of the bone. Cartilage doesn't have any nerves or blood vessels in it, so it's actually just to create a lack of friction and make the sockets work nice and smoothly. If something happens to the cartilage or the synovial sheath surrounding it, so for example, inflammation can happen in the synovial sheath, then the synovial fluid thickens and it becomes an inflammatory fluid. This sends signals to then start repairing or making more cartilage. What happens is this cartilage, the quality of it becomes worse and worse. So it's got a lot of collagen type 2 in it. And that can reduce to collagen type 1, which is thicker, more fibrotic. And so then that gradually wears down and then you exposes the bone in the joint. So once you've got bone on bone, then you've got the start of osteoarthritis and a lot of pain, because there are a lot of nerve endings and blood vessels in the bone. So bone on bone can create massive amounts of pain, and then it can start wearing. And what happens is then that creates this inflammatory process that means bone lays down more little nodules of bone. It's trying to protect itself. And these are the chronic situations where the body is working too hard and it goes wrong and it gets in a loop. and we want to remove those moments. So an injury that's after 72 hours, we're going to give it 48 to 72 hours. It goes from acute, where inflammation is necessary to protect the injury, then it can start to become a chronic thing, which could go on for a cycle of weeks, months, and years. And that's when equipment, things like ultrasound, laser therapy, manipulations, range of motion, all helps to try and disperse this chronic inflammatory fluid. And therefore, you can stave off things like osteoarthritis from becoming worse and worse and worse, and stopping these joints from laying down more little nodules of bone that then scratch on the inside of the socket. And it's just this vicious cycle. So that's sort of an overview. It's really important when you're looking at your bony landmarks that you understand where the muscles lie. We've got 7 cervical vertebrae in the neck. The 7th sits behind this scapula, the shoulder blade. And then we've got 13 thoracic, because we've got 13 ribs. So it's really easy to feel where the end of the thoracic spine ends. In between that, we've got this is C1 through 7 cervical, and this is T1 through 13. And then we've got lumbar 7, so that's L1 through 7. So when the vets are throwing you an x-ray and going, we've got a disc protrusion at L6, you'll know what they're talking about. You can literally feel from this T13, and you can feel these little spinous processes on the top, and you can count along. So tonight, when you feel your dog, you can start actually doing this roadmap along the back. And then when you hit L7, which is just tucked behind the point of the hip here, then you know that you're in the sacrum. The sacrum is actually 3 fused bones, 3 fused vertebrae. So what happens is that there's not as much give there. It's not able to swing around. So you can see why the lumbosacral junction, L7 and S1, gets a lot of wear and tear. And this is where you can have a lot of problems with disc disease. So that's because obviously when the dog turns, that's getting a lot of work, because behind it the sacrum is stiff and not working. So the tail will also be used a lot for that. And the same between the junctions, the thoracic and lumbar junctions. There's one called T11, and that's your anticlinical vertebrae. And that's where you see the spinous processes point one direction, and then they change direction on the lumbar. That's because all the ligaments and the tendons that connect, the tendons connect muscle to bone, they're all operating towards the back end this way. And from the thoracic, they're all operating towards the front end this way. So the design of the dog is amazing, and it's kind of split down the middle between everything going that way and that way. And in between that, there's a lot of wear and tear on these discs that sit below that. If we have a little look at how the muscles are around that, now we've got this image in our head, we can start to see that this big sling here around the neck, this is called the brachiocephalicus. It's split into 3. This is one of our main hard working muscles on the front limbs. So when these contract, the muscle shortens. And if you can imagine this muscle shortening here, then that's going to make, because it's attached to the front of the humerus along here, when the muscle contracts, it makes this bone move this way. So that's your main protractor, moving the leg forwards. Okay, so the leg is going to swing forwards when that contracts. Also, not on this diagram is the biceps femoris, and that's the same. So these 2 muscles are really important in making the leg swing forward. On the other side of that is the trapezius, which is split in 2 halves. This is the cervical portion, and this is the thoracic portion. And this makes the scapula move backwards and forwards. The top of this moves backwards and forwards. And of course, when it moves backwards, that means that the thoracic part of the trapezius has contracted, and that's going to help with the leg swinging forwards, because it's going to pull the shoulder blade back this way. Okay, so we're going to look at the trapezius, this big brachiocephalicus, and the biceps femoris for all major problems with the shortening the swing phase of the leg. So if the dog isn't isn't stretching its front leg out as far as it should when it's, say, trotting or running, then you look at those muscles and think, well, maybe that it's guarding those muscles for a reason and not using them for a reason. Can be an infinite number of reasons, but at least we start to understand what muscles might be compromised, what might be tensing up. The same thing when you're looking at the main retractors, the leg swinging backwards. We're going to be looking at the triceps here. And the triceps are big. There are 4 triceps, and they all go from the back of the scapula here, and they are all attached to this olecranon and along here. So these are your main, when they contract, they make the leg come backwards. Okay. And also the lats here, they contract and they help the leg come back. So again, if the dog is in pain, then they might be tense here because they don't want to bring the leg back. It could be because there's an elbow problem, could be because there's a shoulder joint problem, but basically they're trying to shorten their stance really so that they're protecting themselves. So these are all really interesting to look at on the front end of the dog. And on the back end of the dog, you've got the quadriceps, which are the main ones that swing the leg forward. The gluteal, this is the middle gluteal. That's the big squishy one you can feel. And that one helps elevate the limb. So that picks it up. These are interesting ones to look at when you've got things like hip dysplasia. And this one is your superficial gluteal. And that is works with your hamstrings back here to bring the leg back. So that is your main retractor of the leg. So when you've got hip problems, the dog doesn't really want to extend the hip. It's painful. So it doesn't really want to bring the leg fully back. So what happens is the hamstrings and the back and this little gluteal muscle here, they start to atrophy. They feel soft. They're not working as hard. They stop contracting and they're not used as much. So if you feel like your dog might have hip issues, it's really easy to just start feeling the hamstrings at the back of the leg. And you can compare sides and see, is one side stronger than the other? Is one side a little bit flaccid, is a little bit weak, or is the other one a bit fatter and a bit, working harder? So these are the main muscles that we're looking at. Then we can have a quick look. Remember the spine in different sections. Then we can have a quick look at for later on when we're looking at spinal issues. This is actually the head of the dog pointing this way, so we flipped it around a bit. But this is the top spine processes that we've been looking at. And then these are the discs underneath, and the discs run through the vertebrae, the body of the vertebrae. And this is the spinal cord. And when a disc bulges like this, then it can impinge on the spinal cord. And that's when you get blocks in the electrical signals up and down the spine. And also around here, these are the exit and entry points for the peripheral nerves. So these can be motor signals and sensory signals. So the motor signals come down and make the animal move, and sensory signals send signals up saying, oh, there's pressure here, or a little bit of pain or touch. And this all gets processed up and down the spinal cord, which is your central nervous system. Okay, so when we're looking at things like disc disease, which is really, really common, I see so many cases of disc disease, you're basically looking at this part of the spine, and you've got 2 parts to it. This is the nucleus pulposus, and this is the annulus. And this is basically just a bunch of rings around it. It's all really collagen and mainly water, 80% water, and some proteins as well that give it elasticity. With discs, you can either get a complete what's called extrusion, and that's when this inside portion actually bursts through these rings and impinges on the spinal cord directly, and that's much more of a major situation. Or you can have this inside just pushing a little bit and then making this disc bulge and sit uncomfortably, and that can give a kind of long-term pain situation that can be corrected easily with anti-inflammatories to allow the nerve to calm down, and it can go back. But once the disc material bursts out, a lot of times you're going to have an operation to remove that material so that it doesn't keep impinging on the spinal cord and causing problems with the signals going to the limbs or up from the limbs or to the brain. So that's kind of a basic overview. I would say that the major areas that we're looking at are shoulder, elbow arthritis, because you can see why. It's a complex joint. There are 3 bones. There's the humerus sitting into the radius and the ulna. And the ulna here, it's got a cup like this and 2 little bones here and here. They're quite thin. So when this humerus sits down here, this little bone sometimes, say when a dog is jumping off the sofa a lot, it can weaken, and sometimes this can actually splinter or fracture and break off, and then that can obviously causes problems later on. And whenever you damage the bone like that, you've obviously damaged the cartilage, and then you go back into that situation where you can cause chronic inflammation that then obviously leads to osteoarthritis. And that's why injuries can lead to arthritis later on, but it's not always apparent immediately. So if we can do physiotherapy and start strengthening and removing chronic inflammation, then we can actually slow down the process of the osteoarthritis kicking in. And you can never, once it's started, you can't actually stop it, but you can definitely slow the process. And I've seen really, really amazing things happen with that. You can also make sure that you manipulate the joints so that synovial fluid is distributing around it and feeding the cartilage with nutrients. So even just passive ranges of motion, when the dog's lying on their side and you do bicycling and things like that, you can really help prevent further chronic problems. So the elbow is a complex joint and leads to, I think they're just calling it compartmental elbow disease now. It's kind of an umbrella term for all different elbow problems. The scapula here, there's a little socket in the end of the scapula where the head of the humerus sits, but it's really quite shallow. And I find this quite a funny joint because it's really not that solid. So you can get a lot of the biceps tendon sits in a little groove here. It attaches on this tiny end of the scapula. There's just like a little nodule there that it attaches onto, and it comes down here and goes through the groove of the humerus, and then it actually inserts on the radius, so it bypasses this big bone altogether. So the biceps femoris is working really hard to control things, especially on landing, and it's not particularly protecting the elbow joint. So the tendon of the biceps femoris can often get inflamed. So a lot of soft tissue shoulder injuries where vets sometimes think there might be a tear, because it's impossible to know, you can't really x-ray all the time when a dog's just limping, a really good test to see if it's actually just inflammation of this tendon through, overuse or just moving around in this little groove. It's just literally you do a little stretch of the biceps just by straightening this leg and bringing it backwards. So you're really bringing it all the way back here, and you'll feel that the dog, you go very slowly because you never want to go into the place of pain, but you can just slowly, and the dog will look at you and you go, that's it, okay. And you can see there's tenderness there if you're not getting a full stretch out of that. So that's a really good test for things. This is a big area. And of course the hips. What happens when with hip dysplasia is that often this little the socket that the femur goes into, the head of the femur goes into, is often a bit shallow. There's supposed to be about 50% coverage with the head of the femur, and it can be like, if it's shallow then it's not, and then it's got room to move around like this. And again, after a while, if it's not diagnosed, then the cartilage starts wearing down and you get osteoarthritis again. So that's basically hip dysplasia. It can start out with puppies, especially in labs, it's a congenital, which means it doesn't develop in the womb, it develops outside of the womb, but it is genetic. And labs, I see a lot of it in labs and retrievers, and they have this hip luxation, which is where it's just out, it's just really lax, it's out of the socket and it's got too much play on it. And you can, if you slow the growth rate of the puppy, don't kind of overfeed the puppy, just keep it really nice and really keep those hip muscles working, you can actually really control that. And but if it goes undiagnosed, because the most common sign is bunny hopping gait when they're running, they'll do both back legs together because it's more comfortable, because it's uncomfortable taking a lot of weight on each leg individually, so it spreads the load. It's a really common sign. I see it all the time when I'm out and I want to go, your dog's bunny hopping, I think it might have hip luxation, but you can't do that to every dog. So it's something to really look out for, and really make sure that you're keeping the fitness level, so you can be zigzagging up hills and front paws on a box, things like that. You can do all sorts of exercises to keep these hip muscles nice and strong and prevent and again, this is where physiotherapy is really good. If you can look at something like that, diagnose it at between 4 and 10 months, then you can really prevent the onset of osteoarthritis at a later stage. So that's sort of one of our major things that we do. Let's see, where else are we going? Okay, so we're getting into actually physiotherapy and what we do. First thing we do when we walk into a room is a static observation. Obviously, if the dog is just the car's rolling up and the dog jumps out, I'm going to watch how the dog jumps out of the car and runs around on its own. But basically, if it's just coming into the physio room, just learn so much about not touching the dog, not doing anything, and just seeing how the dog holds itself. And does it just stand evenly? A dog's weight should be 60% on the back and 40% on the front. So we just need to see, is it standing properly, and or is it shifting to one side and loading the weight a different way? So you can tell a lot with that. You can sort of see, is the shoulder, the top of the shoulder directly by the elbow and the carpus. You can sort of run a straight line. Depending on the dog breed, the back legs is a little bit harder to judge, because some stand with their legs much further back and they're not directly underneath, but essentially you're looking at sort of all 4 corners dropping straight down underneath the dog. So I think I might have said the wrong way. It's 60% on the front and 40 on the back. I'm not sure if I said it that way around. So that's the first thing we do, is a static observation. And then we do the dynamic observation, which is our gait analysis. We might do some sit to stands to see if they do it evenly each time. We usually do sort of a rule of 3 to 5, because dog might sit to one side, just one off. But if they do it 3 times, or 2 out of 3 times, or 3 out of 4 times, then you know that you're looking at an issue. Interestingly enough, you can't always tell which side is the problem if they do sit to one side. Sometimes the smart dogs will protect themselves because they don't want you to touch them, so they'll sit on the painful side. But if they're not thinking about that, they'll usually sit on the comfortable side and not on the painful side. But you have, so there's no 100% understanding of that until you really get to hands-on. So then you do your physical exam, you go through all your bony landmarks and find any trigger points, which will be places where muscle has really contracted. Once muscle contracts in tiny spots, then blood flow isn't happening. So then there's no nutrients going through to the muscle. And so that there's just this fibrotic material. So what you really want to do is try and get your thumbs in there and start loosening that so the blood can flow. We use some instruments like light and heat that can just start opening the blood vessels, vasodilation, and that can really help getting the blood flow again. So usually for the first 5 minutes, I'll put a heat pad on the spine, or I'll use red light therapy on the spine to get the blood flow going. And then we can really see where the problem areas are more easily. So massage is really, really important. It's quite a technique. It takes a long time to really learn how to do it. You really have to, especially as you're dealing with so many different types of dogs, so many different ages, different adipose tissue. Are they fat? Are they thin? Are they fit? Are they old? It really is quite a hands-on thing that you have to just map in your brain and learn through time. And it does take a while. And some dogs really don't want to be touched at all. So then you have to use other ways to get voluntary behavior from them, because obviously you never ever want to force them into anything. Which is helpful because I'm a behaviorist as well. So I definitely try and take my time and let the animal approach me and stuff like that, and use a lot of high value treats. Joint mobilization. So that's we'll do once we've had we usually start from the neck, go all the way down the front limb, and then all the way down the spine, and then the back limb, and do some tail twirls, and we'll try and move them around to the other side. So you're just working slowly from top to bottom. Once you've got the massage done and everything's kind of relaxed and you know the dog is relaxed, then you can start doing a little bit of range of motion, joint mobilization. You can try and unstick the facets on the spine, which is nice. You can do a little bit of spinal mobilization, and then you can do some muscle stretching. So you just have to remember that flexion and extension of the joints is different to stretching muscles. So they're two very different things. And so one is flexion of the joints, where you're moving the joints back and forwards and around. And the other is you're holding always on the joints, and then you're actually stretching out the muscle. So for example, if it was the hamstrings, then you'd have a nice straight limb, and then you'd gradually just bring the leg down and forwards, keeping everything nice and straight. And then you're actually doing a really nice hamstring stretch. You have to do it very slowly and very, very carefully. But if you're going to do a hip flexion, then everything stays flexed, the stifle stays flexed, and you're just going to bring this bone all the way up here as far as it will go. And that's joint mobilization as opposed to muscle stretching. And then you go on to, after you've done all of those things, then you use your electrotherapies such as ultrasound, laser. You can use a TENS machine for nerve stimulation. That's really great for pain or for firing up nerves as well. And then you can do your therapeutic exercises, where you can use things like wobble boards, balance cushions, steps. That's all your kind of Pilates type exercises. So that's the last thing you do. And then you can give some home exercises as well at the end of that. So that's a basic, that's a hour-long session, and a lot of it spent on massage and joint mobilization. Gait analysis is great. So like I said, we've got so I'm going to move this picture out of the way because I can't see. So what we're looking at is some obvious signs. So this is the interesting part to me. You're going to look at the dog walking towards you and away from you. You're going to have them walk from side to side, and then you can see from side to side is really important, because you can see if the stance has been shortened at all. The back leg should hit where the front leg was, where the front paw was. And a lot of times it will be shortened if there's pain. So the swing phase is where you pick the limb up. Swing phase will be shortened usually if there's a muscular problem, and the stance phase will often be shortened if there's a joint problem, because there's pain once you put pressure on the joints. And you look at the walk, which is left hind, left front, right hind, right front. There's always 3 paws on the ground. The trot is a 2-beat, which is diagonal, left hind, right front together, and the other way around. And then we look at the canter, which is 3 beats. And the left hind and the right hind left fore together, but this is very fast. So it's sometimes it looks like all of it's happening at once. Like I said, the 60% of the weight is on the front limbs and 40 on the back limbs. So if there's a problem with the hips, they're going to offload onto the front, which means that they're going to bring their head down to take the weight off the back. So this is going to put stress on the neck. So often with hip problems, the neck is going to be tight or overworked, overcompensated. And also the front shoulder, the shoulder muscles will be hypertrophic. They'll be built really hard. But again, when you're doing massage, when you're doing physiotherapy, you really want to massage those. So you're not always focusing on the problem area as in the hips, but you're actually looking at the overcompensatory areas, which can be the neck and the shoulders, and also the pecs, because they're pulling the dog along more, and they're using this. When you've got hip problems also, a lot of times I'll see a dog might be at home, the home environment might be a wooden floor. And that's a real problem with hip dysplasia, because then what happens is the inside muscles of the thighs are called the adductors, and they're going to be working really hard to keep the hips in from sliding apart. So they'll also be really, really tense. So inside massage of the hind limbs is really important as well on when we're helping relieve, and this is all for pain relief, because when muscles contract for too long and you don't get the blood flow and you don't get the nutrients in, then they become fibrotic, and this becomes a pain cycle. So it's like this tension that creates pain on the nerves, and then it just becomes this huge cycle. So that's where pain relief, alongside the vet with anti-inflammatories or whatever, or pain relief that they give, it's why it's really important to have physiotherapy as well, because the physical process of releasing the muscles and stretching them back out so they're not fully contracted all the time is going to stop this pain spasm cycle. So let's see, where are we at? So so really nice obvious things that you can learn in a second, and that people don't know about, which is so important and so easy to diagnose, are different types of gaits. And it doesn't take long to, well, it takes a little while, but it doesn't take too long to sort of start spotting these things. So let's take a specific breed, say a Spaniel. Spaniels have just genetically a lot of elbow problems. They often have elbow issues. And so you'll see a lot of Spaniels running with their elbows out, doing this. And that's their little paddling gait, we call it, and it's this winging, winging gait, and it's their elbows are winging out to the side, and it's because they don't want to bend and flex the elbow because it hurts. So this is a much better way to walk. The elbows can just stay out and they don't have to move too much. But what happens then, you have to look at what overcompensates will be the shoulders. So they're bringing them up. So the shoulder blades, the trapezius that we looked at earlier, they're going to be, and the rhomboid, which sits underneath the trapezius, is going to be working really hard to pick that limb up all the time. So again, what we're going to go to, if there's a problem with the elbows, is we're going to go to the back of the neck and between the shoulders and start trying to loosen all of that up. And we're trying to retrain the gait to go back to normal. Of course, this has to go side to side with the vet, actually, helping the dog with the elbow problem, whatever that might be. But at least we can reduce some of the pain due to overcompensation. We've got the waddling gait and the bunny hopping is typical for hip issues. So the bunny hopping gait is often with hip luxation in the younger dogs, and waddling will often be hip dysplasia. So by waddling, I mean the bum just picks up this way, and you see the back end doing this. And again, they're using the glutes on top that we looked at earlier to pick the limb up, as opposed to using the hamstrings to push and then bring them up. So you'll probably find the quadriceps on the front are overdeveloped, and you'll find the hamstrings are underdeveloped, and the middle gluteal might be quite firm. And probably the superficial one right at the back will be soft as well and underdeveloped, because that one's not being used to bring the limb backwards. So those are really easy things to watch out for. The other one is skipping. So with stifle issues, obviously you're going to toe tap and not put the foot down, the paw down as much. So skipping gait will often mean that you've got patellar luxation, you might have cruciate problems, all sorts of things. And this is often breed specific as well. I find terriers, a lot of terriers have the skipping gait. See it quite a lot in the cockapoos, the little doodly things, and Pomeranians as well, funnily enough. Have a lot of patellar luxation. So sometimes when somebody says they've got a terrier and it's the skipping gait, well, it's just what terriers do. Well, it isn't. It's that they have a stifle issue, but it's just that it's so common. People see it and go, oh, that's just the way they are. Pacing is offloading from side to side. So pacing is when, instead of trotting with diagonal limbs, they'll trot with the same limbs on each side, and they're usually because they're offloading for some pain issue. Triple tracking is just simply where there should be making two lines, just train tracks with the front and back legs, and if there's a third track, then obviously you've got an issue with one of the limbs trying to overcompensate, coming under the body or outside the body. So you're going to be looking at the head bobbing up and down. If it's bobbing up, it's taking weight off the front limb, so you've probably got a front limb issue. And the limb that it's coming up on, it will be the bad one, and then it will come down on the good one. So that the downward bit is the good limb and the upward bit is the bad limb, and vice versa. On the back, the head will come down to lift the weight forwards. So these are all really simple things that you can start looking out for in your own dogs, which I think aren't that difficult to learn. But I find them really interesting, and you'll never watch a dog running around in the woods the same again. Don't know if that's a good thing or not. So let's have a look at what's next. So we're just going to look at some of the common conditions. Spondylosis, that's when the spine starts laying down bone, and it can start to develop underneath. These little bone spurs can join, and then it makes the spine really rigid. That can be really painful as well. Well, it is really painful for the dog, because what it does is impinges on nerves. So that's one that does need probably pain medication as well. And we've got spondylitis, which is inflammation of the spine. Hip dysplasia, we've talked about developmental elbow disease. We've talked about cruciate problems are really common now. And a lot of the surgeries involve what's called TPLO, which is tibial plateau leveling osteotomy. And I see a lot of dogs with this, and our job then is to retrain the gait, because what they tend to do is, even when the limb is better and they're pain-free, they've got a learned behavior where they don't use that leg, and then the muscles atrophy, and they could just carry on like that. It's a funny thing, but because we can't speak to them and say, hey, you need to put weight on that leg, they just don't do it. So you've got to retrain the brain and retrain the gait, and that's another job for the physiotherapists. Soft tissue injuries are just often we're just using laser and things like that, and stretching to stop the tissues from healing, fibrotic and shortening. So those are quite straightforward. Iliopsoas strain often comes hand in hand with a knee injury, because what happens is the iliopsoas is just a little muscle that is we didn't talk about this, but it's high up here, and it actually helps bring the leg up, brings the knee up, and it works really hard. So it's the main hip flexor, and so that get back to here, that can often be strained because it's being overused for a compensatory issue. This is just a quick thing on osteoarthritis. I don't think we need to go into that because we've already talked about it. So if you have cruciate ligament problems, it can be a disease, it can be a traumatic injury. The disease is quite common, and the cruciate ligament is cross. There are two actually, and it's the cranial, the forward one, that tears, and it's attached from, this is the femur, and this is the tibia and fibula. So this is the knee, this is the patella, and it goes from the back of the femur to the front of the tibia, and it stops the tibia from moving backwards and forwards against the bottom of the femur. So when this snaps, these two bones rub against each other backwards and forwards. So this is one of the most common operations. It's not the only way to deal with it, but this is what we see a lot. Is what they do is this is the patella, just so you know. This is the patella ligament. This is the quadriceps going along here, and this is the tendon going over the quadriceps, and this is the tibia, and this is called the tibial plateau. So hence the TP. And what they do is they slice it here, and it was at this angle so that it could move forwards and backwards, and they make it horizontal. So now it can't slide. And then they put a plate in and keep it at this angle, so that now you've just got this nice horizontal plateau, and it stops this sliding because of this ligament gone. So it's quite a neat way to fix it. But of course, then you need to really start working on flexion of the knee, because the dog won't use it. Let's see what else we've got here. I think this is just some hip dysplasia. You can just see a quick diagram of what I was talking about. So that's a nice sort of 50% coverage of a healthy hip, ball and socket joint. And this is what happens when you've got a genetic problem with the femur, the head of the femur here. and a shallow acetabulum. And this is, we talked about this, so these are the hamstrings atrophying. This is just showing you an X-ray of the spinal cord when you've got a disc extrusion or explosion. So this is the disc we were talking about. This is the inner stuff. This is the nucleus pulposus. And this is called the annulus fibrosus. It's all a lot of words, but this, when it extrudes out, it's usually to one side or the other, which is why it impinges on those exit nerves. And it's because these outer rings aren't fully formed at the edges. You can't see it on this, but they're a little bit weak, so that usually pushes out one side or the other. And this is just when the inner part, the nucleus, just pushes a little bit and bulges, and that causes this impingement on the spinal cord. So these are the body of the vertebrae. This is your spinal cord going through, your spinous processes are above it, and this is your disc pushing up into the spine. And of course, this is your central processing system of things going up and down, your signals going up and down. And so the signals are going to be interrupted, and that's why you're going to get wobbly legs or ataxia or problems with your proprioception and where to put the feet. And that's why spinal cord problems create these weird walking movements. So nearly at the end of this, I don't know what the time is, if we're okay on time. Yep, perfect. Okay, so this is just basically, we always have to look at the contraindications of the equipment we use. So if an animal's pregnant, or if there's cancer or epilepsy or infection on the skin, open wounds, a lot of these things are definitely don't use any of the equipment, so we always have to make sure we know why we're using what we're using. And then we have all our lovely equipment. Weight shifting is great if you've got a dog that is not using a limb because of gait problems, and you're trying to build these muscles. Then you can lift limbs and do gentle weight shifting. You can use wobble boards, wobble cushions. These have little knobbles on them. You can also use them for neurological reasons. You can rub the pads on so you can start waking up the neurological system and the sensory signals here. This is great for core work, and getting the dog to just general fitness and any kind of core work that you need. Lovely stretches. You can use baited stretching if you want to say this is a nice tricep stretch. This is also a tricep stretch in recumbency, so that's really nice. And you're always supporting the joint here, but you can remember there's the shoulder blade here and the triceps coming down. So if there's any kind of injury or shortening of the muscles. Steps are brilliant. This is great for hamstrings. You can literally just put a licky mat down there, and and it also stretches out these little iliopsoas, the hip flexors here as well. So you're doing two things in one go. And we use a lot of these peanuts as well. You can actually pop them under the dog for support. These are great for TPLO surgery, just having to pick the knee up, flex the knee fully and step over the poles. And of course, you can gradually heighten them as the flexion gets better and better. So those are just a few examples of the actual things we can use. This is if we wanted to use electrotherapies. I like this for muscle atrophy. So this is the back of the dog. These are the hamstrings. And you can just see here, contracting the muscle. So if that's atrophy due to hip problems, we're on a modular thing, and it's just contracting. So it's basically you're doing this and you're building up the muscle with a machine. Let's see, we've just got a couple of case studies. This is one that you saw before, Debbie, and this is our little girl that we've since got a diagnosis. We didn't have a diagnosis on. She came in with a soft tissue injury or possible elbow injury. But she's actually got elbow arthritis, and then so we're treating her for that successfully. And this other little girl, unfortunately, this was undiagnosed. Again, it came in as a soft tissue injury, but obviously it was something much more than that, neurological. So we got extra tests. I found a lesion in the cervical spine, and so we did go for an MRI. Again, with the vet not recommending that. And I went to the vet and said, I think there's something in the cervical spine here, because you can, you know, elicit a reaction that's quite consistent. And he was wonderful, and he said, okay, yeah, let's go for the MRI, because it's expensive and you don't want to start throwing out these things to owners and then it's wrong, you know, and they've just spent £3,000 and it's nothing to do with it. It's just a soft tissue injury. But it turns out, unfortunately, she does have a tumor in her spine, so it's not operable, but we're making her comfortable, and hopefully she's got some time in her left yet, because she's wonderful. And this is, I thought, throwing the shepherd. Finally we get to the shepherd, and she's doing great. She's doing a lot of hydrotherapy, which I am going to add in once I can afford the equipment, because hydrotherapy is really, the equipment is expensive. And can't play this one. Oh, there we go. And this is little Mitzi, who has she has a few things. She's got hip dysplasia, so you can see that tilted pelvis where she's protecting herself. She's very tight in the abdominal muscles around here. And can you see the hip flexors here working overtime, really, really tight? And inside her thighs, the adductors pulling everything in really tight. So every time I massage her, going to the inside of the thighs is a real relief. Can you see the way the hocks turn in? That's because the ball and socket isn't working properly. So the little stifles are coming out, the hocks are going in. So classic kind of symptoms of hip dysplasia. She also has disc disease as well on top of that, so which is very common. And disc disease, by the way, is just a natural process of the discs dehydrating, because they are sort of 70-80% water, and they dehydrate and they just shrink and get over time. And that's everything. That's it. That's my talk. If there are any questions, sorry, I feel like I've just blabbed on for ages, but I get carried away. But
no, it's really interesting, really interesting. So what when you was talking about the TPLO surgery and that, going back years when I had a dog with cruciate, the vet I had then was like a real old-fashioned vet, and he more or less advised me not to have the surgery. He said you're better off not having it, whereas now they all push for it. So what is the difference, like, if they had the surgery or not?
How long ago was it?
Oh Christ, that would be about 20 years ago now.
I think it's because of these different processes now. They wouldn't have had this TPLO then, so they wouldn't have had the metal plate and the ability to change the angle of the top of the bone. And so now they've got that. It's a really successful surgery. But before that, I would imagine they'd just use a suture or something, which they still can do today, but it's probably quite an invasive surgery and probably not very successful, is my guess. So I don't know, but I know that these new techniques wouldn't have been around then. So yeah, that's probably
I know. Back then he was an old, I mean, he was a brilliant vet, but at the time he just said, well, if I operate, he said, he's still going to need great rest. He said, if you give him great rest now, you know, we've got a chance of it healing and we'll be in the same place. So he sort of,
maybe it was only a partial rupture, but if it's completely gone, it's never going to reattach. So you're always going to have this problem, and then you are definitely going to get a very swollen joint. So I don't know, you know, I don't know back then, but now I know they would certainly always recommend it.
That's why they opt for it now. Yeah, and looking at what you showed us there, it's obviously the way to go, I think.
Yeah, it's expensive.
yeah, that's the only problem, isn't it?
Yeah, get insurance.
So, anyone else got any questions? No, everyone's gone quiet.
Well, it's 8 o'clock.
Yeah.
Yeah, go on. I was just going to say, I have a boy with me, Dylan, who has obviously got problems with his vertebrae because his legs go all over the place when he walks. He's slightly similar to DM, but it isn't, because he's been like exactly the same probably for 3 years now with no changes.
Yeah.
But yesterday he was out in the paddock with me and he spun round to look at me, yelped, and I was like, what's the matter? What have you done? And he looked away and then limped into the kennel. And he's been reluctant to wait there on his front leg. So I've been giving him minoxidil. It's been easing. It was a little bit better this morning, but obviously he had to have some more today. But I'm just going to keep an eye on him. But as you were saying, it's a neck injury, which is now obviously the tractor nerve in that front leg or whatever.
Yeah.
But I would imagine it stems from this yelp that he gave in his neck.
Yeah, probably a nerve impingement.
So at the moment, I've just got him on minoxidil. Well,
Yeah.
that's what I think, yeah. Because if you saw this dog walk, he's a real ataxic walk. His legs go in all directions, but he's always been like it.
All 4 legs?
But yesterday was this, like, turned round and we got the two. Yeah, all 4 legs. Yeah.
So
back
like
worse, definitely the rear end's worse.
It's
But
one of our welfare dogs, and when I picked him up, he's like a bendy bus.
yeah, he is. Yeah. He looks like a dog. If you didn't know better, so he's got DM, but he hasn't, because nothing's deteriorated and nothing's changed. And his front legs are just as bad. If he walks next to you, trip him up.
He could have what's called. Pardon? He could have wobblers, which is cervical vertebral instability.
Yeah, I've seen that.
Genetic, and that.
But don't they deteriorate a lot with that?
Pardon?
So is it degenerative? Wouldn't he deteriorate with it? If he had wobblers, would he deteriorate?
Possibly with this dehydration over age, it could get worse. It depends how on.
There's not been any change
because it can be there are 2 types. It can be malformation of the cervical the cervical vertebrae, or it can be an instability where they're moving a bit. And it can, it can stay consistent for a while, but if any other changes happen, like the disc dehydrate, then it can exacerbate it. But the fact that it's affecting all 4 limbs means it's coming from the neck. And the upper motor neuron, you've got upper and lower motor neurons, and the upper motor neurons control the lower. So often the back limb will be actually worse than the front limbs at first, and then it kind of can affect all 4 as badly.
It's all over. It's the first time
you could get an X-ray. You could get an X-ray of the cervical spine, and you'd find out a lot.
Yeah, he's a welfare dog. He's not mine. He's a welfare dog. But yeah, it's a possibility. It's just to find out what it is. I'd say he's not shown any pain signs at all, except for yesterday when whatever he did. But we've all done it, haven't we? Turned our head round and gone, oh, I can't move my neck now.
Yeah.
So hopefully.
Yeah.
I'm hoping it will settle down in the next few days. If it doesn't, obviously I'll whiz him up the vets and get them to look at him.
Yeah, but if you've got some anti-inflammatories in the meantime. Yeah.
I have. So yeah, with all my lot, I've got one dog here who's got elbows like a pair of footballs because it's so arthritic.
Oh, where are you based?
Real crotchety ones. I'm in Essex, down near Colchester.
Okay. I wonder if I could, it'd be good to get, because physios, I'll often work for free for a rescue organisation. So if there's a dog that somebody's fostering or anything like that, I'll come and see them if there's a problem. So maybe we can put a shout out to a physio in Essex near you to come and give you a visit, but not charge.
To see, yeah, that's right. He's a bit of a cantankerous git. He doesn't like people that he doesn't know, but he's quite. Once he gets to know you, he's fine.
Sounds like a typical
he's just and we don't know his background. He's had a tough life, and he's got half an ear missing and a bit hanging off. So we know that the woman that he was with was quite spiteful with them, and she thought nothing of using the stick that apparently was behind the door on them. So whether he's had an injury to his back or not,
she could have damaged something.
Yeah, quite possible, isn't it?
Yeah,
that's what we wonder, whether she damaged something.
Yeah. Oh God.
Yeah.
We'll keep in touch about it.
I know. I will. Can I ask you something? I know I'm waffling because I've got so many dogs here. Have you ever seen a German Shepherd who's like tendons in her feet have all gone? She's got flappy feet now. She's got her toes are straight on all 4, and she's only 6 this year. And it happened when she was about 3. My vet's seen her and he went, I'm completely baffled. I have no idea why that's happened.
The back legs.
It's all four, isn't it, Rose?
Front feet, all four, isn't it, Debbie? I call her flappy
They're like
feet because,
flippers.
honest to God,
Wait,
they're
you're
like
saying
flippers. Her toes,
she's that way or that way?
she's flat. No, flat. Her feet are just flat. She's wide. Her toes are all spread. She hasn't got a claw-like foot. They're all like that.
Yeah, okay. Will you send me some images? Send me some video of her. That sounds like something that could be easily diagnosed.
You might be interested. I tell you, I've never seen it. Even my vet went. He said, I've never seen anything like that. I would have walked through and seen whether I can.
No,
get this camera on her
I think
feet.
I have seen that. So yeah, send me that over.
Yeah, I will. I'll send it to you.
Yeah.
It's too old to do it that way. She's got a phone.
Yeah, no, just send me some videos and we'll chat. We'll chat after.
All flat. Yeah, all flat. Okay, I will do. Yeah.
Yeah.
Okay.
I
I'll do
don't know
that.
how
Okay,
Debbie, you'll have to just send my details if that's okay.
Yeah, absolutely fine.
Cool.
Yeah.
Hear that, and I'll send them all to you. There's nothing I can do about it. I'm sure damage is done, but even my vet was flabbergasted. She was about 3, and she got an intermittent lameness, which nobody could quite get to the grips with. And in the end, I even had her blood tested for Lyme's disease because I get a lot of ticks in the woods where I am. I thought, has she got Lyme's disease? Is this why she keeps going lame from one foot to the other, and she's just not well in herself? And it all came back negative and nothing was ever found. But within a few months, I thought, what's the matter with your feet? And as I was literally over the course of a few months, they just splayed. And they are now what I call flappy feet because she smacks you around the head with them and you know you've been smacked with them because there's no tightness, no grip in them. And she walks right on the flat of her feet. And her nails, of course, are constantly having to be clipped because they get so overgrown. She doesn't walk on them.
Okay, no, that sounds
And
like
it's all four.
some kind of tendon problem. So yeah, send that over to me. I'm sure we can get to the bottom of it.
Yeah, I'll get it off. Yeah, and I'll send it to you. I'll do a video.
Okay.
Okay.
Cool.
Brilliant.
Right.
Thank you.
Anyone else got any questions?
No, it's very interesting. Very interesting.
Yeah.
Good. I'm glad you enjoyed it, and thank you all for coming. I really appreciate it. I can talk about this forever.
Kate, are there any sort of just general everyday exercise things we can do with our dogs to help things, just to keep them fitter, healthier, or?
Yeah, I think controlled exercises so they can run around, do all the stuff they normally do as dogs. But if you set about 10-15 minutes twice a day, just doing things like a controlled baited sit to stand so that they're evenly having to push up, so it's not fast. That's really good. Zigzagging uphill is really good because they get to use both limbs evenly, but they're pushing off. Standing up on a step, you can just give them a treat. If you just go online and get a wobble cushion, they're about 10 quid, that big, back limbs on that, just a little bit of weight shifting. They're going to be using their small muscles around the hips, and same on the front limbs, just a little bit of weight shifting side to side, just gentle, just stuff like that. It's really simple. And then you can get these little Cavaletti poles in the cones that, again, they're like 20 quid, controlled stepping over, so that they're using their joints properly and they're using their weight properly, and you're just keeping them nice and straight. I would do stuff like that, and then you're really helping them.
Brilliant.
No, thanks.
Cool.
Thank you.
That's all right.
So just that my dog was making a noise. I didn't quite hear what you said about the wobble thing you get.
Get a wobble cushion online, go on Amazon.
Cushion.
Yeah, and then just you can put the front legs on it, just gentle weight shift, or the back legs, gentle weight shift. Uses all the little small muscles around the joints, so that will really help.
Do you by any chance know Amanda Daniels that does the myotherapy?
No, not Amanda Daniels. No, I know there's another one that does the Galen myotherapy. Can't remember
what she does, Galen myotherapy.
Yeah, I know someone else that does it, so I know of it, and I know it's really good massage techniques. Yeah.
Yeah, because I've got a spaniel with problems. He's 10 and was just tearing my hair out. And after 3 sessions with her, he's just a different dog.
Yeah.
So yes, but I just wondered about the wobble cushion as well on days that I can't get out, you know, when the weather's bad, and just to do that bit extra with him indoors.
Yeah, definitely. Definitely.
Yeah, no, I hadn't heard of that.
Yeah. It's an easy one.
Yeah. I can't see him walking over things. No, you wouldn't do.
Yeah, all these depend on the dog, right?
Yeah, oh yes. People say, you know, I've got this new coat, and you put their legs in. Oh no way. Not with him. Don't put that on me. But no, he's quite a different dog now. So he had to have x-rays, because I was getting to the point where it was making me as distressed as it was him.
Yeah. Because
we tried the Labella injection because we thought it was the arthritis, and that didn't work. So he hasn't got arthritis. So he's had the £900 worth of x-rays. But he's on a low dose of Metacam and a quarter of a paracetamol night and morning, and it seems to be doing him an awful lot of good.
Brilliant. Yeah.
And with her helping him move more, but he was just like one of these toy dogs that you used to see on wheels. You know, he just wasn't doing anything.
Oh,
so
a lot of pain.
Yeah. So
cool. I'm glad it's better.
Yes, no, we're getting there. Good.
Because
you think all sorts of things, don't you? Now, is it a tumour? Is it this and that? As you said, the as the vet said to me, you know, well, that's cost you £900. I said, well, what about if we had and I'm not insured anymore? And I said, about if we had MRI, I said, oh, that's out the question. But it was good that I'm really glad that I did it, because it put my mind at rest that he hadn't got the things that I was thinking of. And I worked in a vet for 10 years, so in my vets for 10 years. So it's all up here. I've seen it all.
Yeah.
That's not good. That's not good. It's like with Debbie, with that, you know, she's seen it all.
Yeah.
So whatever happens, you think straight away, that's what my dog's got, you know. I'm as bad with the cat, you know. But so no, but I just wondered if you knew her. That's all. She lives in Rayleigh.
No, so, I don't. No. I'm in Chilworth in Surrey.
Oh right, okay. That's over that side.
Yeah.
Well, I found it very, very interesting, especially your pictures of the bones and the muscles.
Oh, great. Okay.
Well, I did go to the Royal College when I was working at Wiley's for a lecture, because I'm going back 30 years and you forget things.
I know, right?
When you get to my age, you know, that's gone out that picture.
I forget it all the time. I have to go back to my notes.
Yeah, so it was really interesting to see the way the muscles go. I had a puppy walk for guide dogs, and I'd never had a Labrador, and I knew there was something wrong with his hips. And I kept telling this supervisor every month she came, you know, there's something wrong, because I'm walking him, I'm taking him in Marks and Spencer's, we're on and off a bus, but he just wants to lay down and he's got something wrong with his hips. And he was rejected, sadly, because I worked hard with him. But what, not sad for my husband, because he was his boy, if you know what I mean.
Yeah.
But he did have really severe hip dysplasia, and they did reject him in the end. And where I worked, the vet did the operation, and he was different boy.
Yeah, it's a really successful operation.
Yeah, it is. Yeah, and I've got really bad osteoarthritis, so I could sympathise with, as Debbie knows, she has problems as well, and you put yourself in the position that they're in with the pain.
Exactly.
So it's no good you pulling them on a lead, and they're, you know, I sometimes don't want to do it, let alone them. Yeah, no, that was very interesting. So thank you.
Oh, you're welcome. Yeah, it was my pleasure. Anytime.
Well, thanks for doing that, Kate. As I said, it was really interesting. So thank you very much for coming along.
You're welcome. And if you have anyone fostering or anything in the area that needs any help, always put me in touch, all right? I'll always volunteer for free.
Lovely.
Cool.
That's
Thank you.
brilliant.
Thank you very much for that. Thank you.
All right. Take care, everyone. Thanks.
Thanks,
Bye-bye,
Kate.
Kate.
Bye.
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 Bye-bye. That was very good.